And do you have the other?
I have two on. I just
Okay.
have them close together.
Excellent. All right. Are we good?
Tell me when. We're good.
Could I have everybody's attention, please? I'd like to welcome everybody to Pediatric Grand Rounds. If you would, just a little housekeeping first, if you would look on the table in front of you, there's a sheet of paper with a QR code. I would ask that you please scan this QR code and log in. This helps us track attendance, both to provide telecasting and food for everybody, as well as CME credit for those of us who are pursuing that. So we'd really appreciate it if you logged in. Today it's my pleasure to introduce Dr. Kiana Johnson. See her. Dr. Johnson, I think most everybody knows, has been working with us here for 2 years. She's a research psychologist. 2 years?
3.
3 years, sorry. She's a research psychologist. She earned her PhD from Purdue and then went on to do a postdoc at University of Minnesota in adolescent health and medicine. She's done a lot of advocacy work in both adolescent medicine as well as with several organizations, including the Arthritis Foundation of America, the Lupus Foundation of America, Gillette Lifetime Specialty Clinic, and also done some advocacy work with rheumatology. So today she's going to talk to us about the role of physicians in advocacy.
All right.
Please welcome Dr. Johnson.
Good afternoon. Thank you. Today I'm going to talk about advocacy, and I'm going to talk about it in relation to policy, but then also healthcare, the diverse roles, or how providers can be involved in multiple levels of advocacy. And I'm also going to highlight different areas that our faculty members are involved in advocacy, both at the state and international level. I have nothing to disclose. My two objectives are first to recognize the various ways in which providers can advocate for their patients, for their profession, and also for their communities, as well as to describe how social determinants of health impact our local communities. And before I actually get started into the actual advocacy presentation, I want to define just determinants of health. Anybody want to give me a brief overview of what determinants of health are?
Maybe like things in people's lives that help shape their health, so their socioeconomic status.
Yes, that's a good example, education level. So determinants of health, they're the social and physical factors that impact the health outcomes of people and populations in our communities. It's important to understand that the health of individuals is closely related to the broader community and the environmental context in which they live. Now, what is advocacy? Advocacy, it's when people support, speak, or act on their own behalf, when they act on the behalf of someone else who needs assistance or who asks for assistance. It's a means to obtain information, services, or resources, as well as to help provide some type of service or connect individuals to resources. It's not an adversarial approach. It's an assertive and cooperative strategy. Are any of you all involved in some type of advocacy work? Be it with an organization, doing some kind of walk or anything? Okay. Well, the role of advocacy for healthcare providers is to promote the rights of the patient and healthcare provider. Everybody is an advocate, especially with healthcare providers. If you don't see why, hopefully by the end of this presentation, you'll be able to say, yes, you're an advocate, a health advocate, and or champion. It's also just to build capacity to improve community health, and also to enhance health policy initiatives based on availability, safety, and quality of care. Health advocacy, it's a team sport. You can't really do it by yourself. It's a collaborative effort, and it doesn't work in isolation with just one individual or one group or corporation. And effective medical care requires disease prevention, health promotion, health protections, and promotion of health equity. And this is all important as health advocates. Physicians, you guys contribute to your expertise and influence the work within the communities or within patient populations to improve health. So you work with those who serve to determine and understand the needs of patients, and you speak on behalf of others, whether it be within creating policies, pushing funding forward to be able to create or develop new drugs or interventions. Your role is pretty important in getting that stuff done. So first I'm going to talk about just building an advocacy strategy, and this is in relation to policy. Over the past 15 to 20 years, I've had the opportunity to go to Capitol Hill every year to do Lupus Advocacy Day, and I also go for the Arthritis Day, but it's every other year. And in doing so, we attend this 2-day class on advocacy, and we discuss, how do you address your congressmen and the Senate, and what are we supposed to say? They give us these sessions on, how do you address them, what is the issue, and how do you make them hear you? So first, in building the strategy, when you want to do policy advocacy work, you want to identify what the issue is. So what's your need? What's your concern? What is the problem? And you want to address whether it's state, local, or federal. And so if it's state, who do you think would be most interested in that? Yes, your state representatives, or even state agencies. So not necessarily your regional directors of various agencies like Department of Child Services or Department of Education, but the State of Tennessee Department of Health. And the same for state and federal issues. And you want to also determine whether it's a legislative issue or if it's an administrative issue. And then who can address the issue for you. And this helps you to know who it is that you're going to speak with, and then you can do your homework. That's actually quite a bit of research that goes into it, because you want to know the facts, and you want to know why you want to be able to provide why you think that whatever area that you're discussing is such a concern. So what's a big area in Tennessee that has been emphasized recently? Legislatively or policy-wise, or even with funding, with the new budget allocations for the state? Yes, right. Does anybody know any other issues? Okay. So there are some other, within the state of Tennessee, there are also, well, in lots of other states, Tennessee's not an exception, but there have been some legislative and funding issues that have come to the table to the state level that should be pushed to the federal level based on how many states are getting on board with the same issue. One is within foster care. The overwhelming, how the foster care system is currently being overburdened with a lack of providers or social workers that can help to provide quality to do their job effectively without being overburdened and overworked, and in terms of their caseload as well. That it started out as a state issue, but many states have brought this concern forward, and it's becoming a federal initiative now. So then, after you have identified your issue, the next you want to do is develop your request. So in developing your request, you want to make it clear and really succinct by providing a rationale and support for why this is important. You want to include statistics, any reports that you have, and any other kind of evidence, because people want to see numbers. They don't want to just see, the state has too many youth in foster care, but they want to know that for youth in foster care, we have over 286 families in the state of Tennessee that are not in compliance. They want to know that kind of thing. They also want to know, how many of these youth have to wait before receiving a permanent placement or a placement for foster care, not necessarily permanent. Or with other health-related policy initiatives. So when I go to Capitol Hill, we advocate for funding. So we talk about the last big initiative that was passed, and it was a really big deal, was in 2011. We went to Capitol Hill and we talked about how the FDA had not approved a drug specific to lupus since the Eisenhower administration. I think that's somewhere around 1950 something. I think so. But I might not be right, but I do know this, the Eisenhower administration. The last drug approved for lupus patients by the FDA was Plaquenil. And the request that we were making was that there needs to be there needs to be movement in research, but then also for more medications that are specific to this condition as opposed to using other medications that are not necessarily approved by the FDA. So in doing this, we went there with numbers, and then we had two different groups. We had adults with lupus, and they had youth with lupus, and I was able to help out with the youth with lupus group because I have childhood onset lupus. I've had it since I was 12, and when we went to talk with our representatives, we all told these different stories of how a new medication could be effective or beneficial. And not only that, but some people also brought bags of medication, empty bottles of medications that they've been taking over the years. And it was a nice experience. A lot of people were not able to speak to their representatives, but I was fortunate enough to be able to speak with Senator Lugar. And that same year, the FDA did approve Benlysta, which is the newest FDA-approved drug for lupus. Yeah. So you wanted to set goals. So for us visiting Capitol Hill, it was to get funding to be able to do more research, to provide better medications, and to also hopefully improve the outcomes for people with lupus. And now they're having more initiatives currently to hopefully do more targeted interventions for youth with childhood onset lupus, the youth being those up to 24. And as you know, so our political process, it usually involves some kind of compromises between, the opposing groups. But usually with most health advocacy groups or with health issues that come forward, you see people that oppose them, but even in the arthritis funding, there was very little opposition to have funding, which I think it was last year $5.7 million for new research funding for lupus and arthritis or arthritis and rheumatologic conditions, which is pretty exciting because arthritis isn't just affecting older people, but kids get arthritis too, so part of that money would also go to funding for youth. But if you look at the demographics of those serving as representatives, a lot of them would be affected by arthritis. There we go. So then next you would want to craft a message. And so we actually worked with a lot of different professionals, and over the course of 3 to 4 hours in crafting, what exactly we wanted to say, clearly and specifically stating the requests and what we wanted them to do. And then providing rationale for why. And then explaining why this is important. So what are the implications for constituents? So who is helped by whatever it is that you want them to do? And then lastly, if it costs money, what is the money to be going? What would we expect the money to fund? And so what would be the results of this? And then lastly, you want to polish your message. Make sure it's clear, it's concise, and it's compelling. But I think more importantly, you want to make sure that it's personal, because though the stories are what make it important, and it makes it, your passion usually comes through in being this credible, having this first experience, this first person experience, and why it matters to you, whether it's something that's affecting a family member or just something you see every day. It comes across better in your message when it's personal. And in this picture, this is from when we went to Capitol Hill, and that's Senator Lugar. And those are some other women from the Lupus Foundation of America in Indiana, the Northwest chapter, and me in the middle. So some key competencies included within health advocacy. So providers should be able to respond to an individual patient's health needs, and then also respond to the needs of communities or populations they serve. And so in responding to an individual patient's needs, this means advocating with the patient within and beyond the clinical environment. Are there any ways that you guys can think of that you might be doing this? If you do it at all? I would hope you are. Are there any ways that you can think of that you've advocated for a patient outside of the clinical context? Right. Yeah, so that is a good example. What about IEP meetings? Have any of you attended an IEP meeting? Yeah, so that's another way, because you go and you help to advocate for whatever accommodations the youth might need. And yeah, or even providing a letter for a similar situation with IEP meetings, or even for a 504 plan, helping the youth to get those type of accommodations. And then, so responding to the needs of the community or populations that are being served, that's done by advocating with the community and on the systems level change in socially accountable manners. So, yeah. All right. So, one way, just a few examples that I can think of in regards to responding to patients' individual needs. So, when you do this, you're also addressing the determinants of health that affect them and their access. Like you were saying, you screen for health for resources. So you're addressing those social determinants. And in doing so, you're also helping the families and the patients to increase their opportunities to adopt healthy behaviors. A lot of you do the CHAMPS, and then isn't there? I mean, even with you all screen for risk behaviors? Yes. Yes. Mm-hmm. So in a similar vein. So it's an opportunity to provide anticipatory guidance for them to adopt healthy behaviors. And then also you're incorporating disease prevention and health promotion, and then health surveillance in the interactions with your patients. So the art of advocacy and best practices, there's this theory, it's called the muscle theory of advocacy, which I thought was kind of interesting. So it essentially states that you exercise your advocacy muscle so you have good and strong relationships, kind of like you're not burning any bridges, but then also you're making connections that make connections. And then you're not overtaxing that muscle, because too much communicating can be counterproductive. It becomes everybody's just talking and there's no action. And then, as I said before, so with the personal story, so credibility is key. You always want to be truthful, even if it seems it'll diminish your position. And even if there's opposition, you acknowledge so, because it still puts forward that you're being truthful, and respectfully explain, why you're right and the other is wrong, or, yeah. So, I was thinking about the ways in which several of our faculty members engage in different types of advocacy, and I looked and saw, so we have Dr. Woodard, he does the TIMI Global Health, and I couldn't remember who else. I remember someone else went to Haiti recently. Yes. Do you want to speak about it? Briefly, in 45 seconds? No, he's not here. Never mind. Yes. Dr. Skatsina has her Reach Out and Read, and she also does Once Upon a Time, her event that is done for the National Child Abuse Prevention Month. Both Drs. Malkani and Dr. Lose, sorry about that, they do work with the Juvenile Diabetes Research Foundation, Would you like to say anything about what that's like?
So it gives us an opportunity to partner from either our academic position or as our community provider position, and to step into a little bit of a different realm, which is just focused on patient advocacy and research on a national and international level. So JDRF, Juvenile Diabetes Research Foundation, has been around for a couple decades, does terrific work, funds a lot of the research that is advancing the everyday care of kids with type 1 diabetes. And so here locally, we're partnered with the East Tennessee chapter of JDRF. We're hosting something called, that we just made up an auction. We're calling it a barn bash for any residents. I think Nina was going to send out an email, but first 3 residents who want to go to the auction, I'll pay your ticket so you can get in free. So let me know if you want to get in on that. And we just raise money, and then it goes for 100% goes to diabetes research. And we're doing a diabetes walk where all the families that are affected by diabetes, we get together at Founders Park May 19th. Either me or Dr. Ford is going to get a pie in the face, whoever raises more money. Last year it was me. We raised $1,000 to take a pie in the face. It was a really good pie. And it's just a good time, good visibility, and your patients love you for it. So you don't do it for the fame, but you do it because it is the right thing to do. And I think it leaves you feeling more fulfilled than just being in the exam room for 40 hours a week for weeks and weeks on end.
Yeah. So in thinking, well, this is not an exhaustive list of all the things that faculty are doing. These are the things that I could think of. For myself, I put youth advocacy because I'm involved with the Arthritis Foundation of America and the Lupus Foundation of America. And I started a foundation about 4 years ago called the CLEAR Foundation, which is a Childhood Lupus Education and Research Foundation. It's a 501c3 organization, but I started it as part of my postdoc leadership experience, and people liked it, so we opened 3. We've started 3 chapters nationally, so there's one in Nashville, one in Minnesota, and another one in Indiana. And then I'm also active with the Tennessee Foster Adoptive Care Association. I'm the Northeast Regional Director. And for that organization, we provide supports for new foster parents, including mentoring experiences where new foster parents are paired with a more seasoned foster parent. And we also create a list of resources of services and providers that other foster families have found to be a pleasant experience for new foster families or for any foster parent who is looking for some type of resource. And then we also help to provide input to the Department of Child Services on the state level about what type of training and what type of revisions should be provided for people that are trying to be certified to be foster parents. It's quite interesting. You learn a lot of things about the inner workings of foster care and the logistics and policy stuff and compliance stuff. It's an interesting line of advocacy. And then for the Arthritis Foundation and Lupus Foundation of America, I do a couple different walks, but then I also help to connect youth with different programs that they're hosting, and then also I help with providing the Youth Educational Advisory Board and providing input on youth programs. So I'm not providing the input on youth programs, I'm collecting the youth so that they can actually give the information. And then for the CLEAR Foundation, we help to support youth and provide resources and help them connect to an adult who also has childhood onset lupus. And we do virtual support groups using UVU. But these are just a few examples in how people have been active and advocating in various ways throughout in our department. And I think a lot of people can be intimidated by the idea of advocacy. Is that something that resonates with you all? Does it seem like it's something hard to do, that's hard to do? Yeah. And I think oftentimes you think, oh no, I don't have this kind of expertise or that. So I'm going to go over just a few barriers or roadblocks. So one barrier is just a lack of comfort with the advocacy process. So just not knowing, where to go, where to start, how to get the information, who do you talk to, and then also feeling like you're not the expert, and so you're not expert enough to be an advocate or to advocate. But really, anybody can be an advocate. Anybody, and I think we're all advocating in some capacity for something, whether we know it or not. And then, more importantly, I think advocacy is. I kind of use the word advocacy and champion, or advocate and champion kind of interchangeably, because in a lot of these cases you're championing for something. And even if you think of patients, you try to figure out how can you, patients need this champion or something. And we've been having these different kind of conversations within a couple of the organizations in which I work or advise about so what's the best type of advocate, and how can you develop a champion, or is it just something that's actually just naturally there? So what do you guys think? Are champion advocate the same thing, or could they be different? Are there different levels? I agree. Yeah, how so?
Work your way up to being a champion after get enough experience as that advocate to know what best needs to be advocated for, what most needs to be advocated for.
Yes, I agree. And when you think of the levels, so when you think of your expertise or like even champion, so I would see Dr. Los as, so he's a champion for this cause. Not only because he's advocating for this, but because he's also lived this. And a lot of the work that we're looking at now with the Lupus Foundation of America, we're talking about like lived experiences and how the best model for someone else to learn is through someone else's experiences. And hopefully something will come out of that. But like even advocating in that capacity brings about change, even in terms of like models and research, but then hopefully in practice. So here's some tips to hopefully help you overcome any kind of roadblocks or barriers that you might experience in advocacy. So you want to be confident. Tell your story, share your experiences with any elected officials, even with people, with your colleagues, being knowledgeable about what's happening, what are the issues, being honest, using plain language, and being polite. Speaking from the heart, and don't overtell your story. Yeah. I think that's important, not to overtell. I think specifically in this region, I love that storytelling is a big part of the culture here, and it goes very well with the idea of advocacy. But you also want to stay on message, so you don't want to get distracted by the little birdie over there. And you also want to ensure whatever group you're speaking to that reflects the diversity of the community and the agencies as well. So this is the picture I was trying to edit for a very long time. I don't know if you all can see this. Sorry. I tried to lighten it up. It was a scan of a picture from 2003. Yes. This is my former pediatric rheumatologist, Susan Boyer. She died in 2012, 2 weeks before my PhD graduation. She was my champion. She wrote the beginning part of my dissertation in the reviews and talked about her being my biggest cheerleader, which she was. But I think we all have the capacity and ability to be a champion, an advocate, and to really make a difference. And whether it's at the patient level, state, community, family, internationally and global, or internationally and federal level, I think when you find ways that you can champion for a cause, you also find that it makes significant differences in individuals' lives. I thought that this lady was my best friend. I really did. But the funny thing is, I also thought I was like her favorite patient until I went to her funeral. I spoke at the funeral, and everybody else there was like, I was her favorite patient. But that's what I have about advocacy. Be a champion. Thank you. Do y'all have any questions?
So, excellent talk. I just had a question about just, for example, Pfizer or HCA, when they advocate, I think they do it largely through like campaign donations.
Yes.
But for an organization like the Lupus Foundation of America, I'm assuming you don't advocate financially or influence public policy through visibility, or what tools?
Well, so it's both. They use visibility and financially. The Lupus Foundation of America is quite well funded, which I thought was surprising. I learned that just through doing that. But with visibility, so we had over 350 people being visible, all in the same shirts, advocating for the same cause on Capitol Hill. And that's what they want to see. They want to see, and even not necessarily just visibility, but who's actually visible. So they want to make sure they're showing that a diverse group of individuals actually get lupus. And when we have, the Arthritis Day on the Hill, the kids get a whole different program because we want the youth to also go and show, kids do get arthritis too. And I think it's actually bigger than the financial part of it. Yeah, it's visibility. It's, how visible are you? Because, if you only have 3 people showing up, how many people does this really affect? Anybody else? All right. Thank you.